So and then I will, if people don't want to talk and ask questions later, I'll have the little chat open. But in the meantime, am I in the middle of your screen? How is it set up? Are you seeing who's talking?
Yep.
I gotta get this. I gotta get this good. Let's see. Speaker view. No, I want gallery view. I gotta see everybody. Gallery, multi-speaker view. Let's see. There we go. Okay, cool. You guys, you keep getting smaller, but that's because more people are coming in the room. But hey, Bill Scarlett, I see you down there. And Christina, I assume you're ACF host. Christina, can you see to let people in the room if they get into the waiting room?
I will try. I
Are
would
you
have to
seeing?
reclaim.
No. Okay. It's okay. You know what? Let it. It's okay. I'll pop people in as they come in. Anyway.
It doesn't come up on my screen.
Oh, cool. Okay. We'll fix that next time. Hi, everybody. And I did record it, Christina. I think the little button's going. And so we'll have a place to put this. Yes, it is recording.
Yes, it
Hi.
did say recording.
Happy Veterans Day, everybody. Christina, your outfit was adorable. I just color enhanced your picture. Christina went to our veterans celebration in Sedona today, and her father was a veteran. My dad was a veteran, and she went in a pair of overalls. You still have them on. They're so cute. She's wearing American flag overalls, which I thought was like the cutest outfit I've ever seen for Veterans Day in my life. But you can also use it for Labor Day and Memorial Day and 4th of July. So you have plenty of opportunities. Anyway, everybody, welcome to our series of our
Sorry.
surgeon survivorship series. So I'm going to ask you guys to mute unless you're talking. Let me see if I can mute. There should be something for me to be able to mute all. Ask all, mute all. I just muted everybody. There we go. I just mute, so now nobody can. You can unmute when you have questions, and we'll raise hands and do whatever. But this way, we don't have to worry about listening to the news in the background, which is so much fun. Anyway, it's 11:11. It is the official release of my book, which is I was supposed to have them in my hands today, but I will have it in my hands tomorrow. So I can assume that today's the official release day because everything is addressed and ready to go. So tomorrow, when I get the books and I sign them, they're going to be off to the post office, and anyone that did the pre-order stuff is going to be getting the book right away. And Christina, we can actually send out the link to pre-order because you can start sending them out from Sedona because I'll be there to sign them this week anyway. So the topic of tonight is shifting gears, living life with intention. It's the title and the name of my second book. You can see the cover. And this book was kind of near and dear to my heart. And the reason that it has the name that it has is because my father was a police officer and was adamant about us learning how to drive a manual transmission. For some of you youngsters, you may have never driven a manual transmission. Jen Slaw, you can juggle, so you should be able to drive a manual transmission. But it was a mandatory skill in our household before you got your driver's license because my dad always wanted us to be able to be safe when we were out with our friends. And if somebody happened to be drinking or was impaired in any way, too tired to be able to drive, he wanted us to be able to drive that car home safely. And so we learned how to drive a manual transmission. And it's an art that's really kind of lost now. Years ago, all cars were made with manual transmissions, and an automatic transmission costs a lot of extra money. Now you're very hard pressed to find a car that has a manual transmission that you buy new because nobody does it anymore. But I wrote this book. I started it when I was in Pennsylvania. I did a writing retreat in 2018 when I was in Sedona, and I really thought that the whole shifting gears was shifting from East Coast, really Western medical model of care to just making sure nobody's in the waiting room. Western medical model of care to a completely, totally integrated aspect of cancer care. And that's what I really thought it was. I thought that, that's why I was called to Sedona. That's why I left the East Coast. was because I was being called to a place and a time where I could really bring together the best of what Eastern and Western medicine had to offer. And for many of you that know me, I mean, Desiree, my guide, we've known each other for, I don't know how many, 20 years now.
21 soon.
21, and, I have patients going back 30 some years who I treated for breast cancer. And that's a beautiful thing because it's a reminder, of this journey that we're on. And what I learned and what I share in this book are um, really, to me, defining moments of my journey and how I took every adversity, every difficult opportunity to kind of turn around and say, all right, what have I learned from this experience? And I think every single person on this Zoom who has had breast cancer has had to ask themselves the same thing. Or if you're one of our practitioners that cares for our breast cancer patients, we learn from anyone who's gone through this journey and that comes into our lives how to live a better life, how to live a more authentic life. And so that's what this book has become. It's about living life with intention. It's about waking up in the morning and being intentional about every single thing that we do. And many of you know this, some of you don't. If you're on tumor board with me, you know that I have a beautiful 5.5-month granddaughter who I have been her primary caregiver for the past 2.5 months since her mommy went back to work. And I am proud to announce today that I got fired from that job because my my daughter-in-law made a very personal decision that she wants to be home with her baby. And it's something that for any one of us that are moms, um, being being able to be home with your kids, when you can, I think it's one of the greatest gifts in the world. Um, and whether someone chooses to be home with their kids full time or whether someone chooses to work and we use the hybrid model like we did with family and daycare and everything. Everybody's got to do what resonates with them. And I think for a lot of us, motherhood's been devalued, but motherhood's been, I feel like I'm a pretty good surgeon, but being a mom and now a grandmom are like the greatest things I think I've ever done in my life because you see the fruit of your labor every single day in front of you when your kids or your grandchild does something. And right now it's rolling over is a big deal. Like I just don't realize how big of a deal rolling over is. But anyway, so it's kind of cool that the book is coming out at a time when many of us are shifting, and we're shifting in what I see are some very positive ways. Dr. Kreischer, um, who she and I have been in practice now, it seems like forever. Um, she's shifting her focus in her practice to functional medicine. She's not quitting her day job, but Stacy has been on a path, and she's one of the smartest people I've ever known in my life. And so there's nobody better to do functional medicine. But when we talk about the cancer care that we've provided for all of our patients, as surgeons, our main goal, our main job is to cut out the cancer, to remove the physical cancer. But y'all know that it's not just the physical cancer that needs to be removed. It's us being able to help to energetically remove those blocks in our body that don't allow us to reach that full healing capacity, and to figure out metabolically how we how we can nourish our bodies the best. And functional medicine is an aspect of integrative medicine where we're not just looking for a pill to give someone to treat a symptom of a disease. We're trying to rewind that clock to go back to find that root cause. And so I'm just really proud to be, to say like Stacey and I've been in practice like forever now, and her practice is shifting to a place that's really honoring this greater, deeper knowledge that we're gaining for how to best care for our patients, because our healing journey, it doesn't end when we suture the edges of our incisions together. I had the honor yesterday of working in the OR with Dr. Don Francesco, one of my young patients from Sedona. And Deb, you'll know who she was because she was at the Mago retreat with you. She was, I think, 26 or 27 at the time of her diagnosis. And after her treatment, a couple years later, she got pregnant, had a baby. And anyone that has had a radiated breast knows that if you gain weight or breastfeed from that other breast, they're not even anymore. And I had the honor of assisting Dr. Don Francesco in her surgery yesterday so I was a hook holder and a suturer. I wasn't the primary surgeon, but I chose to be present for her surgery because she flew all the way from Albuquerque, New Mexico to Philly. And I didn't go to surgery because I didn't trust Dr. Don Francesco. I went to surgery because of my energetic connection with my patient who, wanted to, after all of this stuff, get back to a place where she could feel healthy, whole, and complete again. And, the surgery that our plastic surgeons do, it's not cosmetic surgery, it's restorative surgery. And when people say, oh, your patients had breast cancer and they got cosmetic surgery, but they didn't. Nobody decides to get breast cancer to get a boob job. Like that is like the biggest fallacy in the world. And sometimes when we do beautiful nipple sparing mastectomies and we don't leave a lot of scars, it doesn't mean that the scars aren't there, because it's the internal scars. It's not the physical scars that define this process of cancer. So anyway, all that being said, I'm really excited about this next chapter of my life, which includes not just, I'm going to look on the side, make sure nobody else snuck in here that I didn't let in. Nope. This next chapter of my career where I am still in part-time practice. Some of you know that because you come see me in the practice. I'm literally just trying to keep the lid on the pressure cooker because Dr. Mazur and Dr. Kreischer are busting their rear ends, and being able to facilitate and help in any way with the practice to do the breast cancer survivorship stuff. I talked to my office manager, Deb, today. I'm going to be helping to do some more of the high risk assessments and stuff like that. And now that my other day job, I got fired from my other day job, I'm happy to be in Pennsylvania as often as my partners need me to fill in, because I get the nighttime goodies of lots of sloppy wet hugs and kisses. So somebody had asked before about like our book signings, and I wanted to just say that Dr. Scarlett and I have two planned. Saturday, the 29th of November, we're doing a book signing at the Redeemer Spark Transformation Center. It's on Warren Road. The specifics are on the website. And I had an opportunity to connect with Val from Rainbows of Healing in Newtown. It's up on 413 Boyer Gannon's, and I'm going to be there on the 30th with them, and hopefully Dr. Scarlett will be there too. It depends when Lily's bus has to go back to college because our kids are our priority. But one of the reasons that this book and this chapter in my life is so important is if you had asked me in 2017 what this book would be about and what I would be doing with my professional career, I couldn't have told you any of it, because at the time, I really thought I was going to Sedona to build this integrative cancer center. For most of you who have been paying attention, you've recognized that, I do post some things about psychedelic therapy. I am not a fan of recreational psychedelic therapy. I do not believe that it is a recreational activity that should be utilized by individuals. I believe that it is a beautiful, therapeutic, wonderful process, which when plant medicines are used in the appropriate set and setting can really lead to a higher level of healing. I'm actually facilitating, and Deb Schindell's on here as well. We're taking a group of women to Mexico in January to do plant medicine. in a very ceremonial process. I believe that the indigenous knowledge and the ancient healing wisdom is so important, and being able to bring women into that space where they can actually be safe, be cared for, and be appropriately supported, I think is something that is absolutely mandatory. I do not believe that psychedelic therapy is for everybody. I do not believe everyone needs to do a psychedelic therapy journey. We have so many amazing ways for us to access these recesses and these deep pockets that we hide away in our body. But psychedelic therapy was a great trainer for me, because a great gift, because when I did my training, I identified I identified something that I had been missing my entire practicing career, and I should have been asking the questions. And some of you have, if you've come in to see me, you may have had to fill out the ACEs score, the Adverse Childhood Experience sheet, where we do an assessment of events that took place prior to the age of 18 that can significantly impact your psychosocial and emotional well-being. And until I did my psychedelic therapy training, I never even thought about an ACEs score. I never queried patients about an ACEs score. And it's something that I believe we need to bring into our cancer programs from the get-go, because our bodies keep score of the psychological traumas and the psychological and the experiences, the things that we experience, whether it's physical, mental, or neglectful abuse. Our bodies keep score of those events. And although we can skillfully, carefully cut out cancer, get negative margins, get negative nodes, we can't cut out that energetic hold that holds on to the body, whether it's in the heart chakra, the root chakra. Our bodies do keep score. And so this next chapter of my life is still going to be focused on breast cancer, but it's really going to be focused on the survivorship aspect of breast cancer, which is why we are doing this Surgeon Survivorship series, because each of us as surgeons are going to bring in our own experience. Like my partner, Dr. Mazer, she can speak to the psychosocial emotional aspect of going through mastectomies as a previvor. And I think her perspective on this whole journey is going to be really interesting for all of you. And from a personal perspective, I feel really blessed that, you know, we have the breadth of experiences to be able to share with our community through this process. The other thing is I want to be able to bring more retreats, because I think that our 2 and 3 day intensive retreats are the most powerful healing experiences we have. Deb Schindel is one of our amazing breathwork practitioners who's done the retreats, and anyone that's come to a retreat and participated in breathwork, you'll recognize that you don't need a psychedelic therapy. You don't necessarily need to take an entheogen or a molecule to be able to get to that place. And maybe I can coerce Dr. Scarlett at some point into sharing how profound the breathwork was for him. And
She's amazing.
Oh yeah. So these are all experiences which had been on the peripheral awareness for me, but now they're right at my center core. They're right exactly where they need to be. And had I not had the experiences in my life that I had, particularly in going to Sedona, I didn't even know how to spell psilocybin in 2019, you guys. I knew that ayahuasca existed because a couple doctors that I knew from on the East Coast had gone and done it, but I really wasn't into puking, so it wasn't something that I hate to puke. So, but at the time I thought it was puking, but now I recognize that it's called purging. Anyway, so from the shift perspective for me is I really did shift gears. I can still operate. I still have good hands. I'm still operating when I need to or whatever. But I would not trade the knowledge and the desire to do the deep healing that I'm doing now for, a full week in the OR, which surgeons like to operate. And if you're in the operating room, it means you're not in the office. So you don't have as many charts to do and as much paperwork. So surgeons like to be in the OR because it's less paperwork for us and it's more fun because we love to operate. But I wouldn't trade what I'm doing now with what I know about healing for being back in the OR full time, because I really truly believe that every single thing on this journey for me has brought me to exactly where I am right now, where Dr. Mazur and Dr. Kreischer and Dr. John Francesca, they're doing the trial with the Mind Vibe, which has our participants are having amazing results with. And for any of our patients in Sedona, you have access to the Mind Vibe through the foundation, through Christina. But that vagus nerve stimulation technology is a game changer in cancer patients. And, I'm hoping that a few years from now, when you hear people around the world going, oh my God, I went for my cancer care and I did the Mind Vibe. And you're going to say, you know what, I was part of that clinical trial because my doctors were very forward thinking. The other thing that anybody that watches late night TV or whatever, you may have seen commercials on for the non-narcotic pain patch, or you might have received a free Jovi, which we gave out to, and we still have them if anybody needs one. And that the work with non-narcotic pain relief is really important to me as well, because we live in a world where we have an opioid crisis, and having a niece and nephew who are both addicted, the ability to help decrease our utilization of pharmacologics for pain relief is a really big deal. And the third thing that I'm working with, obviously, is psychedelic therapy, and also a unique drug delivery system, which spray vitamins and spray medicines that bypass the liver so that we don't have toxicities from the medicines that we actually need to ingest. So to say that my gears have shifted is it's a understatement. I really now know that, I'm a healer who chose to be a surgeon. And despite the fact that I was successful in my job as a doctor and have had an incredibly successful career as a breast cancer surgeon, my soul's been calling for me to just embrace the healer that I am, and to do exactly what I am being called to do. And I'm not looking for permission. I don't need that a boy. I'm just kind of doing it. And I think that's kind of what happens when you're 64. And, I've been beaten up a couple times along the way, and nobody can beat me up anymore because it just has to roll off my back. So I hope any of you that read the book will enjoy it. It may seem like it goes. I was just looking, my sister Anne, who many of you know through the foundation, who's freaking amazing. She's actually coming. She's actually coming down tomorrow because I have to go to a wedding on Thursday, so she's coming to take care of Margot. But since she doesn't have her own grandchildren, Margot is like her. We share in the grandmotherness. But Anne went through, and as only Anne could do, or Marianne, you could have done this too. Marianne and Anne read my book about 1 million times to try to help me, because I'm a really shitty speller, and I don't usually write the same, because I write like I talk because I'm all over the place, but it does cohesively come together. But Anne went through each of my vignettes of my book and gave me bullet points. Bill, I should share this with you. It's a riot. She's reading your book right now, so she'll probably be sending you the same thing, which you can give out if you want to go on podcasts and say, oh, the role of medication in grief, the dangers of distracted driving, navigating grief and loss, the impact of technology on human connection. So anyway, I am excited because and now that I got fired from my day job, I feel like I don't know what I'm going to do with myself. The month of December, I'm going to be here. So Anna and Stacy, I told Deb today that I am happy to fill in till we repopulate our office with staff. And, I can be your MA if I need to. Just be kind to me, because I don't take getting yelled at really well. So, you know, if I take a blood pressure bed or I put the wrong thing in the chart, don't yell at me. But that's where I am. And I'm going to open it up to questions, comments, discussion, anything. Let me see. There's some people in the chat. My camera doesn't work. Hi, Nicole. There you go. Somebody was trying to help. I love that someone stepped in to try to help. Anybody have questions? You can unmute and go for it.
Yeah, hi Beth, it's Hattie. I want to know how to pre-order your book.
Oh, Christina, can you send out the link to the pre-order? To, you know what, Hattie, I can probably send it to you. Wait, did she
Okay.
just send it to me?
No, I
So
sent
you
you
can just go
something
to
else.
you can just go to the website, right?
Yeah, it's
I
right
think
on
it's
the,
on the website.
if you go to the HCF website, it's right on the front page.
HCF.
HCF. It's hcf444.org, and it's on the front page.
Okay,
And
cool.
yeah, because we're Christina, poor Christina has to. I have if and when you come to visit me in Sedona, I have a driveway from hell. It is like the steepest driveway ever, and nobody's going to be driving up. Nobody's going to be driving books up there. So Christina's going to be schlepping a bunch of books up the back of her car to get them up there. So that's how you get the book. Or you drive over to Harleysville and pick it up or come to the office. I will have them there in the office within a week. But
Oh, good.
I for many of you, you know that Chris O'Donnell, who's one of my very dear friends who died of ALS, this past Sunday was 20 years to the day that she passed away. And if you read my first book, you know that she sends me ladybugs. And Sunday morning there was a ladybug on the windowsill when I looked outside.
Oh, wow.
And saw these deer. And I'm going to her son's wedding this weekend in Palm Springs, and every single day there's been 3 or 4 ladybugs that have come up to me. So I'm like, okay, Chris, I'm paying attention. Well, what do you need me to do? Because I'm going to be there with bells on. So anyway.
Aw.
All right, cool.
Will the books be available for purchase at the book signing?
Yes, they will. Just in time for the holidays. And Dr. Scarlett's is really, can you believe he got
Love it.
the Rockwell cover? Like, what the heck? Bill, who did you know?
Yeah, that's impressive.
Yeah, he is impressive. And look at this cute picture of him and Amy on the back. I really like it.
Yeah, I love it.
Yes, demanding compassion. You know, he had to write this book after working with me for 20 years because it's like after you have to follow DuPree in the OR, you have to demand compassion. I figured that's what the name of the book was. But when I read it, I was like, oh, thank God, I'm off the hook.
So wait, so you're going to have books at the signing as well. So I can just wait till then, right?
You can do that. Yeah, we're going to have the books will be at the book signing available for purchase as long as bills get here. Bill, do you have an update?
And
He
you're going to
said
have
this
2 days, the
this week.
29th and the 30th. Is that what I
Yeah.
heard?
The 29th is going to be in Huntington Valley and the 30th is going to be in Newtown.
Do you know the
And
time in Newtown and where?
the time it's going to be at Rainbows of Healing, and it'll be from 11 to 1.
Oh,
It's
cool.
on Sunday the 30th. And Rainbows of Healing is a beautiful, phenomenal crystal shop, sound healing, amazing healers. Amy Harvey, Dee Dee Walsh, and I actually interviewed them for our radio show about 15, 18 years ago. And we did a sound healing thing. So I am actually going to pull up the CD when I get back to Sedona on Sunday and upload it to the website because they never got a copy of the show because our website went down and all the links to all the shows went away. But because I'm an old-fashioned girl, I actually have CDs from all of those shows.
Beth, can
Oh,
you
yes,
hear me?
Great.
It's
great.
Brenda.
Yep.
It's
Hi,
Brenda.
Brenda.
I don't know if I turned my video back on.
There you
but
you do.
am I here?
You're
How do I look?
adorable.
Oh, yes.
You're adorable.
I have not had the privilege yet of reading the book, so I will come to one of the 2 signings. But can you speak to, and maybe you do this in the book, so I have to wait and see, I think for those of us who were on the call and even people who will come and buy the book, I mean, I know you personally, so I know your energy and your healing and your emotion. But is there something in there that talks to those of us who are, me fortunately, that mine is Ned, as you have told me. But when people are diagnosed, and then they have to go through the healing process. I mean, that is shifting gears. I mean,
Oh,
whether
yeah.
it's leaving a
Mhm.
job or dealing with a health crisis, be it cancer or anything. Do you talk about that in the book? About maybe some of the tools that many of us can take with us when we have to change, whether it's lifestyle change, it's family commitments, a job, whatever.
Right. Well, I do talk at length about it. The one of the chapters in the book is called GPS of the Soul, and it is it really emphasizes how when you're going through life, so many times, like I'm just going to use my beautiful daughter-in-law as an example. She's a phenomenal school teacher. She is loved by her kids. She loves teaching, and it has been her passion and her purpose, and she's been teaching for the last 6 years. And um, because so many of her friends have come back right after they've had babies and go right back to teaching, um, it wasn't for her. Like she was missing something, and instead of just saying, "Suck it up, I gotta keep doing this, I gotta keep doing this job," she was true to herself, um, and true to her baby, and true to this process of saying, "This is what my soul needs. This is what my intention is." So, living life with intention is about becoming intentional in what we do. Like, um, you may not, you may none of us have like this blueprint that's kind of printed out ahead of us. There may be a blueprint, but like sometimes if you're building a house and you got a blueprint and you come across some rock in the corner where you can't dig, the foundation is deep, you got to come up with a plan B. And so many times in our lives, people stay kind of focused in this narrowness because they started on this path like, oh my God, I got to do this, I got to do this, I got to do this. And although, yeah, you give up an income, but what you gain is your, like, it's your soul's purpose. And I heard her say, like, I have always, like, being a mother is the most important thing to me. It's the most important thing that's ever been to her. And it didn't, this doesn't make me a bad mom for, going back to work after I had babies as a surgeon. It means that each of us has to do what we've got to use our moral compass, our internal soul's compass, to help us navigate these um, these twists and turns in our life. And just like Brenda, you looked at your jobs very differently after a cancer diagnosis, um, and no longer allowed the toxicity of a job, to be holding you hostage. We make these decisions, and I can say for this experience in the last year that just the changes in what you've done in your life for yourself have been, monumental, which is why I think, you know, part of why your response to treatment was so profound is because you took ownership of all that stuff. And so, yes, I do absolutely provide tools, and it's not advice. It's more like, I'm going to say inspiration,
Mm-hmm.
inspiration to be able to make those choices for yourselves.
Yeah. Okay.
Does that help?
Yes. Thank you. Thank you.
Beth,
What? Yes.
um, will you be doing a book signing in Sedona?
Yes, I will.
Do you
When
have
that is, well, now you'll be able to get one sooner because since I'm going to be there this weekend, I'll be here Sunday. The books will be there already. I'll make sure Christina gets them out to our practitioners. But now that I lost my day job as caregiver, I'll be able to plan one out there. And the Health First Foundation wants me to come out and do a talk at Seven Canyons in December. So I just found out today that I'm fired after Thanksgiving, which is all news to me, but I'm really happy because it's like the saddest happy. Does that make sense? Like I'm sad for me because I have been soaking up every freaking second with my beautiful granddaughter who I can make her belly laugh like nobody else, but of course I could, right? Make faces. But yeah, sometimes someone's going to get my camera and I'm going to be shot. It's going to be done because I have so much goofy footage on there. But I will be back in Sedona and I will set up a book signing, and I'll probably do one in December and also January at different places. But the goal with all of this is, every penny of this book goes back to the foundation. So I'm excited about it because I think we're going to be able to do even more and more programs where Jody's going to be the surgeon survivorship person in January to basically probably take us all through a really amazing guided meditation to let go of what no longer serves us and to welcome in what we want in our lives. And we're going to continue doing retreats. We're going to start looking at next year. We're going to look at other ways that we can enhance what we're doing with the foundation through small group work. Susan Apollon, anyone that's in the MetaFriends group knows how amazing Susan Apollon is, and that format of that small group. I'm seeing you guys shaking your heads, Kim, Beth. You guys know it's that group is priceless. For any of you that have ever worked with my sister Sue with TRTP, I'm doing a talk for the Mind Medicine Australia in March. That's also, you can also register from that on the website. And I also am really excited because we want to expand the number of people that we can get on the Mind Vibe on a regular basis so that we can improve sleep, so that we can improve, everything with the vagus nerve. Every day I find out something else cool that the vagus nerve does. I'm blown away by it. I am doing I'm doing a lecture in February. I'm hoping to drag Scarlett out there to the, it's called the Oncologic Naturopathic Conference. It's like 2,000 or 3,000 naturopaths that are, they really focus on functional medicine and metabolic health, and basically changing the terrain, changing the soil that our seeds, so our seeds don't grow in them. And the vagus nerve has such an important role to play in this. And I do believe it is going to pan out that we're going to show the incredible role with immune function. So, my desire and what I'm going to make happen is that once the clinical trial is done, we're still going to make the Mind Vibe available both in the East Coast and in Sedona, and hopefully other places in the country. But my little microcosms are both going to be covered, and I want to make sure that people stay in a state of homeostasis with their nervous system, because cancer, some people are already in fight or flight before cancer hits, but if you're not in fight or flight before cancer hits, you're definitely there afterwards. And getting back to a place where your parasympathetic nervous system, your vagus nerve, is strong is really important. And I also work with several, I'm going to call them gurus because that's what they're called in India, but master teachers, excuse me, who have statistically significant data proving that the breath work that they do, the yoga of immortals, can stimulate the vagus nerve and actually boost the immune system. So this isn't just about going and sitting on a machine. But once you've done the Mind Vibe and you feel what that level of relaxation is, you want to be able to stay there. And then, so that next step is going to be, providing more and more opportunities for either day retreats or sessions to be able to learn how to calm your nervous system yourself. And anyway, that make sense? I forget what the question was.
Mm-hmm.
What's next?
I just want to say I have such gratitude for all this. It's so amazing. I'm so excited. I'll be there at Rainbows of Healing for the book signing, and the breath work that I did with Deb at the retreat. I have never in my life experienced that kind of breath work.
I agree.
It was whoa. And
Deb,
Jody,
you should get on there and say thank you. You're welcome. Deb is
Oh,
listening.
amazing.
She's on
Thank
here.
you so much, and you're so very welcome at any time, pretty much. So
Oh,
just
amazing.
all I can say is, yeah, it is pretty amazing, and it doesn't even involve drugs. I mean, I love psychedelics, and I love that kind of therapy, but I love the fact that also for some people that's just not a really good fit.
Yeah.
And there's so many other ways to get there. And breath work is such an easy thing. You can go in as deep as you want. If it's too much, you can back out. You're in total control of your breath, your body. So it's an excellent alternative to a lot of these other methods and has incredible benefits. So highly recommend it, however you can get it.
Mhm.
So yeah,
I'm-
pleasure. Thank you so much.
It
I
was
appreciate that.
wonderful weekend.
yes.
And we will be doing more retreats. That I think between small groups and retreats, to me, that's the future of this deep inner spiritual healing, because what I plan to do with January is we're going to do some work beforehand, obviously do the 5-day retreat, and then do the group sessions when we get back on a regular basis for at least 3 or 4 months, because it's the things that unfold after a
Mhm.
psychedelic journey that particularly if you've done it with a group of people, there's a shared energy in that experience that is, like, you guys know from doing the retreat with Deb and Jody, there's that shared energy in the group that is so powerful. And anyway, really excited about that.
It's so true. But then after the weekend, after like months, you're like, wait, where'd it go?
Well,
To find it back again.
that's why I am really feeling like, to do this stuff, we've got to commit at the beginning that we
Mhm.
stay connected through it, because you don't want to lose the momentum for what you learn when you do these deep, it's soul work. Like, this is,
Mhm.
it's soul work. And I didn't put this isn't, there's some of this is in the book, but my mom had a car accident when she was pregnant with me, and it was pretty traumatic for her. And after I was born, I was the seventh of seven. I think she was pregnant within 8 months or something. It was like crazy. I don't know. My dad should have been like, he should have been tied up to a post or something. Jesus, eight kids in 11 years. Anyway, after my mom had me, she ended up having a second trimester stillbirth, which they called a miscarriage at the time. Which I am just appalled that would be the term, but that's what they used back then. Anyway, they put my mom on Mother's Little Helper, which is Valium, and so it pretty much dampened her affect for years.
Mhm.
And I got, it was just, it's so clear to me that this time that I have had right now with my beautiful granddaughter has been as good as it was for her to have me care for her here. It has been so healing for me to have that connection that I probably didn't have when I was a baby. And it may have been why, might have been why I chose to go back to work when I did. I mean, I had loans, which is why I really had to do it. That's the big thing. But um, I miss that. I miss that bond. And believe me, I will whenever I have a new grandchild, my butt's going to be right there. I'll be ready to pick up the slack for anything. I'll cook, clean, you name it. Because those moments when they nestle in and they fall asleep on your
Mhm.
shoulder. How about it, Marianne? Is it the best thing? Is it the best feeling in the world? when this little baby curls up
Mm.
and falls asleep and drools on your shoulder, and you
Mm.
just feel them breathe, and it's like it's the greatest gift, and the most healing.
Mm-hmm.
Penny, I see your face.
I'm here.
Anybody?
I
Go ahead.
do have a quick question. I've been kind of on the backside for a while because I had a frozen shoulder, which I'm doing much better now.
Yay.
And
Yeah.
I'll be starting up with doing, the healing touch and surgical coaching again, probably in January.
Good.
And I'm wondering if that office will still be available to me in Southampton.
The office is available, but we just have to know. I'll connect you with Ashley, because she's
Okay.
doing our clinical trial, just because that's the room that we're using for the Mind Vibe. But
Right.
yeah, yes,
Okay, good.
because it's important to prepare for surgery.
Yeah. And it makes such a difference in the mind and the relaxation as well. So,
Oh yeah, oh yeah.
okay.
Who else has a question, comment, concern, anything?
Beth, I have a quick question about the Mind V because I was really interested in it. What if you have a vagus nerve that gets like stimulated for no reason? Because I recently figured out that that's what happens. Is that something that would not be good for me to participate in?
How do you know that you have a vagus nerve that gets stimulated? That's the question.
Cardiologist at
Oh,
Holy Redeemer. Yeah.
what do they? Oh, if they think you have a medical syndrome with it, we can actually talk through.
Yeah, I'm
If you
curious because I'm really
do me a
interested.
favor, do me a
Yeah.
favor and call the office,
Okay.
and call the office and just
I'm there
put.
next month.
Okay, so am I.
I know. Okay.
Because I well,
I'm
if you
curious.
yeah, if you have a medical thing with your vagus nerve that they're concerned about, probably
I'm
not
not
good for you.
concerned. They wrote it off, so I'll
Oh,
talk to you about it. That's
all right,
fine.
cool, awesome.
I'm interested.
Who else has a question, concern, comment, anything? We're shifting, ladies, in a good way. I'm hoping that we're shifting to be healthier overall. And I've kind of, regardless of what anybody's political affiliation, we need to all be as healthy. We all need to be able to be as healthy as we possibly can be, whether we're lifting weights, hiking mountains.
Mhm.
Everybody and their dog is playing pickleball these days, playing tennis, skiing, rollerblading, I think is coming back but wear pads if you're going to do it. But, being physically active and really being conscious about the foods that we eat and how we prepare them, and went through a whole thing that's not even here with finding out that our family has an issue with this MTHFR gene, so we can't clear toxins as easily, and almost every processed food has folic acid in it since 1998. And so a lot of the mental health issues that are happening are potentially related to diet, and are affected by, ADD, ADHD stuff is affected by high levels of folic acid in our diets. And these are the kind of things that I'm hoping, through increased awareness in our food sources and how we do what we do as a country when it comes to processed foods, is getting an awareness of who is at risk, which requires testing, but it requires us to actually think about it. And Chris Kalinich, I saw you shake your head, but it is such a big deal for, and I want to have MTHFR, Mother Effer Foods. Mother Effer Nutrition is. I was looking. I'm going to try to get the trademark. But it is a crappy. It's a crappy genetic SNP that keeps you from being able to clear toxins. And we have it on my husband's side, and His sister got 2 breast cancers 20 years apart. And his mom died of pancreatic cancer, which is a really common cancer with that gene as well. And so now becoming aware of it and looking at the foods that we eat and recognizing that, you know, you got to look at 20 different loaves of bread to find one loaf of bread. Dave's Killer Bread doesn't have it without folic acid in it because it's everywhere. It's ubiquitous. Because in 1998, the government was trying to prevent neural tube defects. So the road to hell was paved with good intentions, and it was good intentions, but not good intentions for the 40% of the population that has a methylation defect. And that's why my granddaughter is my greatest teacher.
Mm.
Let's
Beth?
see who else is here. Yes. Hi, Susan. Beautiful Susan.
Hi, sweetheart. I just for the I'm sure that others have read the book, but I do want those who are on this call to know I love the book. And what I'm hoping for is that those of you, when you go to read it, you will do what I did, which is you begin to identify there are the things that Beth writes about that we've all thought, let's say, when we're with the doctor or we're getting tests done. But we see how she has evolved, how she has, quote unquote, changed gears, shifted gears, and really shifting gears for me is essential for healing. And it is what goes on, but we're often not even aware that we're doing it. So, what I encourage you to do is to just think about, well, if Beth is doing this, I guess, think about how it applies to your own life and that you're doing very much the same thing. And this is healing. As you watch her she becomes more conscious of what she's doing and she shares some of the adverse events in her life, which, by the way, I thought that was just written so well, Beth.
Thank you.
There were situations that you wrote about where I didn't want to leave the page. I mean, I loved how you were writing and I loved what you wrote, but the meaning that you take away from it is really the essence of the book. And it has everything to do with the fact that we really are capable of, once we become aware and conscious of what's happening in life, and that maybe there is a higher meaning, a greater meaning, but we can contribute so much to our own healing. You know,
Oh, yeah.
shifting gears is what healing is all about. And we absolutely do it throughout our life. So it's a great title. I love the metaphor. And I hope you all enjoy the book as much as I did.
Thank you, Susan.
You're welcome.
Listen, if I hadn't had the experiences that I had, I never would have done the breath work. I never would have done the plant medicine. I wouldn't have done the training in the plant medicine. And I wouldn't be at a place where, you know, I don't know if you guys are aware of this, but Texas passed a law there, and it was a bipartisan law. It only had like 2 people in the entire Senate that voted against it, and they're half Republicans and half Democrats. They're doing research with ibogaine for veterans because that beautiful plant medicine iboga has the opportunity to help heal the worst PTSD on the planet. And so I think that we are at this juncture in medicine, and I think Deb can speak to this too, where she and I have been rooted in our Western medical worlds, and now seeing how plant medicine comes into play, how breath work needs to be elevated as a validated, recognized methodology for mental well-being. We're shifting. We really are. Like healthcare needs to shift, and it can't keep drifting into the iceberg. We got to shift, and so we're doing our piece. We're doing our part one piece at a time. The next book, which I'm already working on, is called, I haven't even held this one in my hand, but I'm back to writing again. It's called Arrhythmia of the Soul. And it really speaks to that dissonance that happened in my soul. And some of the really deeper aspects of what I have gleaned from the breath work, from the plant medicine, and more importantly, from allowing this time for integration, which has taken, it's taken years, but it's beautiful integration because it's bringing all the pieces together.
You know, breath work, it's been so many, many, many years since I started studying it, and I was working on my my PsyD at the time, actually. It really did change my life. And your breath is a gift you're born with. We just haven't learned, many of us, how to put it to good use. Let's put it that way. But it's the essence of meditation, it's the essence of prayer, and certainly has everything to do with our ability to help ourselves heal. So, yeah,
It's been fun,
hard.
Susan, because
Go ahead.
I've what I've learned from having my beautiful little granddaughter is, if when she's getting ready to go to sleep, if she's fussy or upset about something, um, I know from doing breath work that there is a deep hum that I can do where I feel the vibration in my lips, I feel the vibration in my chest. And the minute when she's on me, and Chris, you can use with your grandkids too, all you have to do is hum, and you get that vibration, and it stimulates their vagus nerve, and it brings them, like, she is asleep within a minute. It's the most gorgeous, and like, I didn't know this when I had kids. I was, jumping around and back and forth and doing whatever. And now I just gently sway side to side, and I do this beautiful, very, very deep vagus hum. And not only does it put her to sleep, but it's so calming for me. And it's like, this time has been the greatest gift in my life, to have these months of this beautiful child who's teaching me. Like, I knew she was going to be my teacher. I saw that in my plant medicine journey, but damn, I didn't think she was going to teach me this much this fast. But it is, so if any of you need, I could sit on your shoulder and you can hum and see if you can put me to sleep. But next time you have a beautiful baby on you, and if you hum, you just feel how they just melt on you because they love that vagus nerve stem.
I never thought about why it's so easy to put your child in the car, and when you ride, there is the hum, which I never thought
Yeah.
about until this moment. I
Yeah.
always thought it was the vibration of the ride itself, but it's
That's why if
the hum too.
if the car's too expensive and it doesn't make any noise or whatever, you're not going to get the sleep. So,
That's true.
Ladies, gentlemen, anybody have anything else? I love y'all so much. I'm really excited. This is a big shift for me. Like, I feel like I'm exactly where I'm supposed to be. I had planned to commit my entire year till June, to being here with Margo. So now I'm gonna have some time to do some stuff, but it's good. It's a good feeling.
Exciting.
Yeah.
Thank you, Beth.
Thank you.
Thank you
You
so
guys
much.
are awesome. If anybody,
Thank you.
you can also put, if you have any questions that are private, you can either put them in the chat, or you can also send them through the website, because I'll get them. I don't think there's any other questions. Oh,
Thanks,
so I've been
Beth.
doing breath work for the last 2 years. It has changed my life. This is just something, I love that you're going down this path. It's going to help so many women that just do not know where to start their healing. 12156. I love you, whoever you are. So thanks, everybody. Thanks for being here. Next month, we're going to learn how to demand compassion. Scarlett's just used to me just being demanding. I was really glad that he added the compassion on the end of that, because, otherwise it would have been just the story of working with 3 female surgeons. Nicole, thank you, babe. Again, like, if anybody in the future is interested in the next chapter of plant medicine as well, you know where I am. So,
Thank you. Thank you.
all right.
Thank you.
Hopefully see you soon in Sedona.
Penny, I'm glad you're good. And I'm happy to have you back helping our patients. They need you, sweetie.
Thank you.
Deb, when are you going to be in Sedona?
right? No, right before Thanksgiving.
Oh, okay. I
I'm
think
gonna
I'm gonna
spend
miss you though
Thanksgiving and a bunch of chunk of time there until, sometime in December.
until your man's birthday. All right, everybody.
Thank you. Mahalo.
Thank
Aloha,
you.
mahalo.
Thank you.
Thank you.
Aloha.
Aloha.
Adios.
Let me see how to leave.
Ginny fell asleep. Ginny. Should I call her?
Just
Hey, Joanne
text.
Miller. Yeah, I know she's snoozy. I'd fall asleep too. It's all good. Good night, everybody. I don't think Lori's still on her. She asked about tuning forks. I love tuning forks. Bye, guys.